there are some criteria that all have to be met in order for some kids to stay in school, even if they are a close contact. Can you explain the reasoning and how kids can still be safe and still go to school?
Yeah, so there really are 4 different criteria where someone could be a close contact. What that means is you've been within 6 feet for longer than 50 minutes and still be in school. Those 4 criteria are, hey, it was a K-12 exposure, not from the community. We're convinced it's a K-12 exposure. Another exception is both parties were wearing masks, and we're sure of that. A third exception is we know they were at least 3 feet apart. So those are things that are important. And I think the final thing is we know that the infected person and the close contact were wearing masks all the time. If we're confident of those 4 things, then we're pretty confident that we don't need to take the student out of school. Why that's important is we don't want to quarantine people out of school that we don't need to. We really know it's important for kids to be in school, for their development to be normal, their socialization to be normal, and they learn more. And, if there's one thing we learned from the pandemic of 2020 is, prior to 2020, kids would often say, I have to go to school. Now we hear kids saying, I get to go to school, which is a great thing.
Yeah. So how should folks, because we've had some concerns from parents who say, we don't want our district to say, hey, we need you in school because we think we met these criteria. How should schools go about this? What do they need to do to be absolutely confident that all 4 of those boxes are checked?
The schools have worked with the Department of Health and Department of Education all year long. They've got the playbook. They understand the plans. So I think the schools have it. They understand how to do it. The school nurse teachers have been great at working on this. And quite frankly, one of the things you're really seeing the schools do is they're very purposeful in doing their contact tracing. And it's not the first time they're doing this. They did it last year. It's different this year. It's different this year because Delta's different. And because we're seeing, Delta, which is more contagious, more community spread, but the schools are prepared. And I think so far they're doing a really great job.
Mm-hmm. So when we have seen a couple of schools close, and it seems like it's by virtue of the time that they get notification. I know that one superintendent told me that, hey, we got this notification now. We can't stay up and call people 3 a.m. We just need to be closed tomorrow. Is that what you're seeing?
Yeah, there haven't been a lot of school closures yet. And I think you've seen a couple. I think part of what you're seeing is schools are looking at their own logistics and how they can solve their issues. And, quite frankly, our testing is a lot better than it used to be, but you don't get the results always in a time to make that decision and call people. So, the schools are making good decisions. They're working together and they're working with us really well. So they're very happy with the partnership. It's a great partnership we had last year, and it's only getting better this year.
So when it comes to immunizations, I know we're very high when it comes to teachers and school staff, and we were already in June, I would say. I'm sure the number obviously can only go up from there. When it comes to student vaccinations and whatnot, can you talk about those efforts and maybe, what we're hearing about the potential 5 to 11?
Yeah, I think the 12 and older uptake has been okay. I would have liked it to have been better. One of the things that concerns me as a pediatrician, as well as a public health physician, is I'm surprised how many students are coming into my office and they've already made a decision without asking me. They trust me to take care of their asthma, they take care of their strep throat, all their aches and pains, but they're making this important health decision without me. So, one of the things I've just said to my parents and my patients is, hey, can I come into this conversation? Can I answer your question? Because one of the things I'm really finding is when I talk to my patients, they haven't thought about what their question is. What they've really been focusing on is what they've heard through social media and other myths. And quite frankly, I can work with that, and I'm happy to do that. I don't know when we're going to see a vaccine for 5 to 11-year-olds, but I can tell you demand looks robust. Like one of the things I'm hearing is people want a vaccine for that 5 to 11-year-old crowd. My guess is we might see something before Veterans Day that comes out with an emergency use authorization. And if that were the case, that would be really helpful. Well, let's wait and see together, though.
Exactly. And for the folks who say, it's because, kids are changing classes now, we're trying to get back to normal in some way. Some schools are, of course, doing it one-way hallways and all that still, but they said, kids are back. Some of the masks are below the nose. what should schools be doing just to really ramp it up and make sure that, these kids are really following those measures to a T, and adults too?
Yeah, I think we have to respect the power of the Delta variant. You know, COVID was a big enough problem last year, but Delta is more stealthy, it's more sneaky, it's much more unforgiving. So if when you're wearing your mask, it's not covering your mouth and nose, you're not protecting others and you're really not protecting yourself. And if you're not keeping your hands clean, that's a problem for other diseases as well. I think one of the things we need to do is role model good behavior, though. Like one of the things I learned a long time ago with kids is way more is caught than taught. So if you're an adult in school, a teacher in school, role model that behavior. Because I think that's one of the books that kids read the most is the book of our life, showing them what to do. And this is one of the things I do when I'm at work. I'm constantly role modeling what proper mask wearing looks like. You won't see me wearing a mask around my neck. It never happens. If you see me, my mask is on the right way, the right time, all the time. I think role modeling and doing it in a gentle and kind way, making sure kids know we're doing this to protect each other. It's never okay to argue with people, not suggesting any kind of insulting. That's never helpful. It's really more about kindly, gently teaching people what the right way to do is.
Mhm. And just going back to all the other health concerns and issues and things that we deal with as adults and children, have we seen vaccination rates go up for other vaccines yet? Or, what are you hoping for this winter?
Yeah, we're in a much better place this year than we were last year. So the childhood immunizations, parents are catching up, and that's a positive. One of the things that's probably something people need to know about, though, is it's time for the flu shot again. So that just came out of the blue, didn't it? But now it's time to think about how am I going to get over to my doctor's office or the pharmacy and pick up the flu vaccine? Because that's something we still need to do too. And I think it's important to have that in mind. It's like, the flu doesn't care. It's going to come back this year. So we need to be better prepared for it this year.
And just one last message. I think when it comes down to it, I know the message always has been, we did not see spread in schools last year. Are you thinking even with the Delta variant, as long as we have these measures, we will also not see spread?
Well, we're doing our best to prevent spread in schools. And we might see more spread in schools because Delta is more contagious. But this gets to main points. If you can vaccinate, you really need to vaccinate. If you're 12 and older, there really is no good reason not to be vaccinated. The other big point is when you're in school, wear your mask properly and wear it all the time. And then I think the other thing is, gee whiz, don't go to school with any symptom at all. With Delta being so sneaky and so stealthy, even a little cough can be the sign of Delta starting. That's one of the things about Delta that makes it more just easily spread. People are showing up to places with one symptom. And this is something we have to be careful about. So if you have a symptom, let's get a test done.
Okay, and one last thing I just thought of, just the state of affairs nowadays. I sadly spend a lot of time on social media and I'm fighting off the myths and all of that stuff. One thing that tends to come up is, how come adults in XYZ situation have to do this, but that might sound different than, kids can still sit in a lunchroom together and do that. For example, Brown University, its own private entity, choosing to, not have in-person dining. Some folks are saying, how come my kid can do cafeteria dining if Brown isn't going to do that for vaccinated adults?
Yeah, and I think it really gets to larger issues of like difference between adults and kids. Right now, although we're seeing an increase in cases in schools, we're still not seeing that much. Kids do need to be just in the school, though. They need to develop with each other and socialize with each other and try to have as much of a normal life as we can. We know that's really important for them. And quite frankly, when children get COVID, they've done really well with it. So you can let kids have a little more of that freedom and you can let kids experience a little more of this life. And we're just going to have to see how it goes. I'm pretty confident, though, we're going to head in the right direction, though. I like what I've seen so far with the schools. I've seen great case finding. The testing's been great. And I think people are doing the right thing so far. So let's see if we can keep that up.